If you've ever had chronic back pain, you know it can feel like this unsolvable mystery, right? A constant ache, but with no clear cause. Well, what if we could finally crack the code? Okay, let's get into it.
You know, it's one of the most frustrating things ever. You go in for an MRI, you see this incredibly detailed picture of your spine, and yet the doctor still can't say, aha, that's what's causing your pain. It's this massive disconnect that leaves millions of people just feeling completely lost.
And there's an official term for this whole situation: non-specific low back pain. It's a fancy label that pretty much means, yep, we know you're in pain, but our best scans can't find a clear, definitive reason why. And that's a huge problem, because it leads to vague treatments and, honestly, a lot of unnecessary suffering.
So, let's treat this like a detective case. Let's break down this puzzle, piece by piece, starting with the diagnosis itself. Okay, so here's the core of the mystery. Non-specific low back pain, or nLBP for short, is basically that gap between what you're feeling, very real pain, and what a doctor can see on a regular MRI. And when you can't find the culprit, well, how do you come up with a good treatment plan? It's really, really tough.
So, what if the problem isn't the spine? What if the problem is with how we're looking for the clues? It turns out there might be a fundamental flaw in the whole investigation.
This quote from the research just hits the nail on the head. It points out this huge contradiction that's been hiding in plain sight. Most people's back pain gets worse when they're putting stress on it, right? But the MRI? That's done when you're lying perfectly still and relaxed. And this just lays it out so perfectly. The pain happens when your spine is loaded, when you're standing, moving around, lifting stuff, but the scan happens when your spine is completely unloaded, when you're just lying flat. It makes you wonder, are we even looking for the evidence at the right crime scene?
This is where the whole story gets so clever. To solve this puzzle, the researchers decided they needed to look for clues under the exact conditions that caused the pain in the first place. They decided to look under pressure.
And they built this to do it. It's a special compression device that lets them apply a load to the spine, about 50% of a person's body weight, to perfectly simulate the stress of just standing up, all while the person is still inside the MRI.
The process is actually pretty straightforward. First, you get a normal, relaxed MRI. Then, they use the device to apply that gentle pressure. And while the spine is under that load, they take a second scan. The last step, and this is the crucial part, is to digitally compare those two images to see exactly what changed. Honestly, the best analogy for this is checking a tire for a slow leak. You don't just stare at it and hope to find the hole, right? No, you pump it full of air, you put it under pressure so you can find the weak spot where it bulges or where you can hear the air escaping. This is the exact same principle, just for the human spine.
And by putting the spine's discs under pressure, these researchers found something that was basically invisible before, a hidden pattern that seems to be the key to this whole mystery.
So here is the big insight. The breakthrough wasn't about just finding a tear or some damage in a disc. Standard MRIs can sometimes see that, and lots of people have those with no pain at all. No, the real clue was in how the disc behaved, how it changed its shape when that load was applied. The secret was in its motion.
And this image from the study just says it all. See that blue line? That represents healthy, non-painful discs. They compress and expand in a pretty predictable, uniform way when you put them under pressure. But look at the red line. That's the painful discs. They deform in a completely different and much more extreme way. It's a totally different pattern. In fact, they were able to boil it down to two very specific patterns. The discs that were causing pain tended to expand a lot at the front, but barely compressed at the back. And the non-painful discs? They did the exact opposite. This specific signature of movement, that was the clue they'd been looking for. So, how reliable was this new clue? Well, get this. Using their model for what a non-painful disc should look like, they correctly identified every single non-painful disc in the study. 100%. A perfect score. Okay, so what about the painful discs? Using their painful pattern, the model correctly identified them with 86% accuracy. For a problem that has been so notoriously hard to diagnose, that is a remarkably high success rate.
And this really puts it all into perspective. Just seeing a tear in a disc on an MRI, turns out that's a really unreliable way to predict pain. But watching for this very specific pattern of how the disc changes shape under load, that turns out to be a highly reliable biomarker for pain. So what does this all mean? What does cracking this part of the puzzle mean for the future, for the millions of people living with this kind of pain?
Well, the potential impact here is just enormous. We could be looking at a clear, objective way to diagnose this biomechanical pain, and that could lead to much more accurate diagnoses, better and more targeted treatments, and hopefully way fewer unnecessary surgeries. In the end, it's about reducing patient suffering on a massive scale.
Now, there's still more research to do, of course. But this new way of looking at the spine, under pressure, it opens up this incredible possibility. It suggests that for millions of people, we might finally be able to stop calling their pain non-specific, and for the first time, give them a clear, specific, and actionable answer.